No one in our state should go hungry. No one in our state should go without a roof over their head. No one in our state should go without affordable and accessible health insurance.
The state's legislative session is still a few weeks away, but some state lawmakers are urging the governor to take immediate action to help people who rely on food, health care, and social programs funded by the federal government. Thanks for staying with us at 6:30. I'm Brent Harden. They say thousands of people in our state are being impacted by federal cuts to these programs and believe the state cannot wait until the session to step in and help people in need. Fox 61's Jamel Johnson is at the state legislative office building where lawmakers gathered this morning.
$332 million of the total $500 million from the State Emergency Response Fund can still be used for federal programs that are facing budget cuts right here in Connecticut. State lawmakers want Governor Ned Lamont to continue to use these funds before the 2026 legislative session begins. Since the state's Emergency Response Fund was created, the governor has primarily used it to help cover homelessness prevention and partly offset lost health insurance tax credits. State lawmakers believe more can be done with this fund.
There's $332 million that can make sure that our residents can get access to the food they need, get access to the health insurance they deserve.
One of the biggest areas Democratic lawmakers believe need addressing is ways to support SNAP recipients with the new work requirements. Senator Kathy Austin believes the state can create their own funded SNAP.
We have people who have applied for hundreds of jobs who are considered to be able-bodied and can't get a job. If we're going to require this, we need to have the system set up to allow somebody to have the capacity to go work.
Austin says this state-funded SNAP will be a revolving program, including a job coach support for those who can't qualify for federal-funded SNAP.
What doesn't make sense is to pull people off the rolls, not give them money for food.
Other programs that were recommended for support include aging and disability services, community health workers, immigrant health care, and urban centers and school systems, with each program costing between $1 to $7 million. State Senator Gary Winfield believes these costs are small compared to how much is in the state response fund.
Many of us were fighting for the pot to be bigger than it was. $332 million should not be what we wind up with going back where it was intended to go. That money should be going to the people of this state who are experiencing deep need.
Republican State Senator Stephen Harding believes with the session just weeks away, this money should be held and used for tax relief for middle-class families.
The money should be returned back to the hard-working people of this state and those that are in need in this state. If there's $1 million that could help offset some of these cuts, I would likely be in strong support of appropriating it from this fund. It just shouldn't have been coming out of a fund. It should have been coming out of our general budget.
Now, the legislative session starts on February 4th. That also happens to be the deadline that the governor has to use the rest of the money in the state emergency response fund. Whatever is not used or committed at that point will be kicked back to the pension fund and can't be touched until June of 2026. In Hartford, Jamel Johnson, Fox 61.